Samuel Njoroge is on the other side of the studio. So we wrap up on this other side, and I hand it over to him to take you through that particular item as you learn a lot. It's over to you, Sam, and, take it away.
Thank you so much, Safin Acheng, and to all our viewers watching. Good morning, Kenya. Welcome to the only way to start your day. My name is Samuel Njoroge. You are right in time for Health Tuesday. A conversation would like to begin right about now. And this morning, we focus on dental health. There are those issues that come with, dental care, and we'd like to take a look at them one at a time. In the event you've got any question in relation to the topic that we'll be handling this morning, all you need to do is to hit up the hashtag Good Morning Kenya on Twitter, and you can also find me on Twitter. Sammy1 is my handle. You can also find me on SMS 22162. Begin with the initials GMK for your comment, for your question to count. With pleasure, I've got the privilege of introducing Dr. Tony Muli. He's not a stranger to the show. He has been here before sometime last year to talk about the very same topic, and so many questions were generated by you, our viewer, on our SMS platform in relation to the various issues he handled back then. Fast forward to March 2018. He is back to pick it up from where he left. Daktari, welcome to the program.
Thank you very much.
How are you doing this morning?
Pretty good.
I've just said your name is Dr. Tony Muli. I know you as a periodontologist.
That's right.
But let's get to hear from you just a little bit about yourself.
Well, you said it right. Tony Muli is my name. I'm a lecturer at the University of Nairobi, where I teach the same subject, periodontology and implant dentistry.
Yep.
I also run a practice called the Periodontist Dental Center at Hurlingham, as well as a training program for dentists who want to advance their skills. Mm-hmm. That's right.
So when you talk of periodontologist,
yes,
or periodontology, is it the same as dentistry?
Well, periodontology is just one of the specialist areas in dentistry. Mm-hmm. So dentistry has various aspects. There are those who deal with replacing missing teeth. There are those who align the teeth. There are those who want to maybe change the shape or the structure of the tooth. And then there are those who deal with the tooth supporting structures. Mm-hmm. And that is where I come in. If I'm dealing with the tooth supporting structures, that is the gums, the bone and the cement that is holding the tooth in place,
yes,
then that is my field.
Oh, great. We've got cement. That's
absolutely, yes.
Yeah, we've got cement.
Yes,
Bamburi,
but not Bamburi. No.
When we were growing up, we were taught and told, brush your teeth after every meal and you'll be good to go. Is that sufficient?
Well, it is not so much as the number of times you brush, but how well you brush every time. Mm-hmm. The best time to brush is after every meal, yes, but sometimes it's not practical. You can imagine during lunchtime, many people don't carry their brushes around unless you have a handbag or a man's bag, I don't know. Yeah. So we would recommend you brush after breakfast and before going to bed.
Yep.
And that last one, before going to bed, I would say is the most critical.
Why is it the most critical?
Well, the thing is, you've been accumulating all these substances in your mouth, whatever you've eaten, drunk, and all that, and it's been building up, and the bacteria have been building up. So by evening, you pretty have a lot of load of microorganisms and food and sugars and all that in the mouth. Mm-hmm. And if you go to bed before you clean that up, then the bacteria will have a field day, because there's no interruption at all. Your tongue is not moving because you're not talking. The salivary flow reduces, and with all that, you get a lot of buildup of plaque, and that is what would then lead to disease.
Aha.
Yes.
Is it part of the reason, or maybe the only reason, why people usually wake up with bad breath?
Absolutely, yes. If you haven't done a good job the previous night, yes, in the morning,
have issues
absolutely.
In the morning.
And
Absolutely.
Get all these white sticky stuff in the mouth and all that. But if you do a good job, in fact, in the morning, you can easily even forget to brush, and you'd almost be safe if you've done a good job in the night.
There you have a kindly note. It came from the specialist himself. Do a good job before you go to bed. You will avoid bad breath and, a situation of not looking so nice in the morning when you wake up. But you say if you did a good job, then you're good to go. What does this good job entail?
Okay, first you have to have the right tools. You have to have the right brush. There are those who use a chewing stick. The trouble with a chewing stick is that it may not reach some certain angles because it's straight.
Yes.
But it's effective where it can reach. It's absolutely good. In fact, some of those chewing sticks, the kind of trees they come from, have some antibacterial effect on the microorganisms. So it can be very beneficial. Of course, mostly we would recommend a commercial toothbrush. And we recommend something medium, or for some people we recommend soft, never hard, because hard brushes will probably just abrade your gums away, and in fact some of the tooth structure, so, and cause sensitivity and many other problems. So we would recommend a medium brush for most people, and for some people who have very thin gums or already have gum recession, we would recommend a soft brush. So with that, and then a toothpaste. That in our setting, I think we would need one with the fluoride. We know that there's a lot of fluoride in our water, natural water in the city.
Yes.
But we still recommend a fluoridated toothpaste just to be sure that the tooth surface has come into contact with fluoride, because that fluoride then hardens the tooth surface.
Let's talk about bad breath.
Yes.
What is the cause of bad breath?
Usually in the mouth, there are many microorganisms or bacteria, germs, let's call them. And some of these, when they metabolize the food substances in the mouth, they end up producing gases which have smell. And some of these gases, most of them are usually sulfides or sulfur kind of byproducts. And these are the same kind of gases that are produced by a rotten egg. So obviously then at that time, this gas would come out when somebody breathes out. And the thing is, a lot of these microorganisms would collect, 40% of the time would collect on the tongue, on the top of the tongue.
Yes.
So if you look at the tongue, and it has this yellowish, greenish, whitish stuff on top, that is microorganisms, and they are producing this. The other thing that might cause bad breath would be gum disease. So you have all these microorganisms and everything collecting in between the teeth and in pockets that are forming between the teeth and the gums. So of course, when they decompose, they obviously will produce a bad breath. But there are other causes like airway infections. It could be a problem in the stomach, and the ring that holds stuff from coming up from the stomach, if it's open, then that gas can come up. And there are many other things,
There are people who seem to have a persistent bad breath.
Yes.
It doesn't matter how much they brush.
That's right.
It doesn't matter whether they gargle on mouthwash. At the end of the day, they're still going to have bad breath.
Yes.
Why is that?
Well, then I would say, I think for people like that, the best thing is let them visit a dentist, and then from there are sequential things that will be done to identify the cause. Where is the source of that bad breath? As I said, if it is the tongue, we advise you clean your tongue and you'll be good.
Right.
If it's gum disease, we treat it. If it's an ENT problem, then the dentist will refer the patient to an ENT specialist, and the condition will be treated and they should be fine.
Okay.
If it's something to do with the gut, then we refer to the specialist and they check it out and treat it.
What's in a good toothpaste? And the reason I'm asking this question is because all the brands we have in the market are recommended by dentists. All of them, the number one brand recommended by dentists, the number one brand recommended by dentists. But again, without mention of brands, what should I consider when I'm choosing the right toothpaste for me?
Well, should I say, one, you need to be visiting your dentist often,
Often.
and then ask them that question. But as a general rule, we would say, I mean, it ought to be from a reputable company. What I've seen in our market is that products are coming from left, right, center, everywhere, and there's no way of saying this is a good brand in that way. But there are known companies that have been in this business for long. They have gone through all the tests, safety, and all that. So I would say try to avoid brands that are not very well known, because you don't know where they come from. You don't know their safety records. Sometimes in Kenya, as we know, it's easy sometimes for things to come through without the safety and all that checked. So I would say most of the major brands that we know, that they would be within safe limits. They would be okay to use. There are specific brands which we may want to recommend for specific patients. For instance, a patient who has sensitivity, if they use a regular toothpaste, it may not help them. So they need to use a desensitizing toothpaste. And there are a few in the market. They tend to be slightly more expensive, but they are very useful if used long enough.
How often should I visit the dentist?
Well, I would say as a routine, I would say at least twice a year. I would say every 6 months. Because what we know is within 6 months, you can start from a fully healthy mouth with all the teeth intact, and by the end of 6 months, you have a huge cavity that is causing toothache. Within the same period also, we expect that microorganisms can build up and cause gum disease. So every 6 months would be the ideal. The worst scenario, don't go beyond 1 year.
Don't go beyond 1 year.
That's right.
But I'm very sure majority of us have gone beyond 1 year.
That's right, because they don't feel that there is a problem. And what people forget is simply because there is no pain doesn't mean there is no problem. That's what happened.
Very good point to note.
Yeah.
Just because there's no pain doesn't mean there's no problem.
That's
and
right.
talking about pain and problems and everything that happens with our teeth, we wait until the point whereby sijalala jana usiku.
I know.
That's when nitarauka and I go to the dentist.
That's
However, what are some of the telltale signs that someone can look out for that can tell your dental health is not at par?
Well, one of the things is that bad breath, as we say. Number two is if you see any blood in the mouth, whether you're brushing, eating, or some people wake up and find blood on their pillow, etc., that's a very good sign of gum disease, for instance. If you feel like you want to use your toothpick all the time and poke in between your teeth, and every time you poke, you feel very nice, that's a very good feeling. Yes. Yeah, that is a very good sign of destructive gum disease now, a bit more serious. Things like if you start seeing your teeth are migrating, moving a bit, or you feel sensitivity, or food is getting packed in between the teeth, all those are telltale signs of trouble.
Telltale signs of trouble. Let's talk about specific problems now that affect the teeth. And I'll start with discoloration, if there's such a term, whereby you find that someone grew, let me not say was born with white teeth, grew white teeth. Then over time, the shade of white keeps getting darker and darker and darker. Is there a remedy to that?
Yes, I think that's why dentists are there. We can fix anything. Almost, We can always restore the teeth back to the person. The thing about discoloration over the years is, one, there is a natural, could we say, just darkening of teeth as the years go by. And that is basically because the inside structure of the tooth keeps thickening, all right? Because the tooth has the white part, which is the enamel. It's actually translucent, light passes through. But the inside of that now is what we call the dentine, and is a bit yellow. So over time, the thickness of dentine keeps growing. Yes, and that color passes through the enamel, and then you get to see this yellowish kind of discoloration. Now that is from inside. It is expected as the years go by, but it shouldn't be that dramatic. Now what we see most of the time is what we call extrinsic stains, meaning there are stains which are on top of the tooth, not coming from inside.
Yeah.
And that is usually because either somebody is a smoker or is taking coffee and stains from foods and different things, which then get stuck onto the tooth surface, and that can be easily polished out. Every time you go for cleaning, that can be removed. Some other times, it's not those stains only, but it's actually deposits of bacteria onto the tooth surface that have now been hardened by minerals which are found in saliva. So now once this concoction of bacteria and the minerals in saliva mix, they form that thing. It's almost like concrete. We call it tartar. So it gets stuck, especially on the lower teeth where the saliva deposits, and the upper teeth on the outside here at the back. That forms quite often, and it looks kind of yellowish.
Yeah.
If it has stayed there long enough, it will turn to almost greenish, dark brown kind of color. And during such a time, obviously, there is usually gum disease as well.
Okay.
Yeah, and all that can be removed.
Let's talk about management of tartar. And what I think in medical terms is referred to as receding gums. You know,
Okay.
the growing, especially front to
The front teeth.
upper mbele is mbili
Yes.
tatu nne.
Yes.
You find the gum is receding.
Yes.
It's receding. What causes that, Daktari?
Right. It's good that you're asking that, because you see, this tartar, by definition, we call it calculus. By definition, is bacteria that have been mineralized, and because the structure is so porous, bacteria hide inside there, and they are constantly infecting the gums. And what happens then, the bone underneath the gum starts to disappear. Okay? The bone does not agree for any foreign object to come close to it.
Oh.
It doesn't, because bone is always supposed to be covered, tucked away from the environment.
Yeah.
So the moment bacteria approach up to a certain critical distance, the bone starts to disappear. All right?
Yes.
Now, as the bone disappears, it is the very bone that is holding the gum up. So once the bone goes down, the gums collapse with it.
Inaifuata.
Inaifuata. Yes. So over time, now, once that has gone down, it exposes a new surface of the tooth. All right? Now the bacteria have a new home. They can colonize that new surface, approach the bone again, and the bone disappears again.
Yes.
So by the time you're 55, 60, cumulatively over the years, if you haven't been doing some professional cleaning, then you find that you lose your tooth because all the bone is gone.
It's just gone.
So when you see people losing teeth in their 50s, 60s, it's not because they are old, it's because of the cumulative effect of gum disease, which should have been treated.
Good point.
Yes.
I mean, let's just get over and done with blaming old age for practically almost everything that goes wrong when we get to 60 and 70. Some of these decisions, we need to pass them as early as now, so that come that age, you can be able to enjoy a good quality life. But again, when it comes to cleaning of tartar, there are people who complain and say it's very invasive. Very invasive, Daktari. Others say it's painful. And I don't mean to scare you. I'm just saying, others say it's painful.
Well, healthcare in this country sometimes can be tricky, seeking for healthcare.
Yeah.
If someone went to a well-trained dentist in this country, I think it shouldn't be that bad.
Should be manageable.
Should be manageable and actually should be okay.
Yes.
I think I see patients all the time, and you know, they have not shot me yet because they are comfortable. Now the thing is, within this same city, we have issues of people masquerading as dentists, and they have dental clinics and things like that, and they give treatment, but they're actually not dentists. So if one went to such a place, and there are many, then you'd expect problems.
You'd expect problems.
But otherwise, if the condition is probably the tartar is a bit deep, usually the dentist will give local anesthesia to make the area numb. And once it is numb, you can clean without any trouble at all.
Okay.
That's right, yeah.
You also deal with tooth structure.
Yes, of course, I'm a dentist, so.
There are times whereby you find a foreign tooth, quote unquote, or a tooth develop in a place where it wasn't meant to. Some get it in some very weird places, but most commonly you'll find, especially the back, some teeth is developing at some angle, at some point.
Yeah.
And to some extent, it's not painful. Actually, you can ignore it and think everything is fine. But again, Dr. Muli, how do you go about handling that kind of a situation?
Right. I think what you're saying is teeth which are not in line.
In
They're
line,
out
yes.
of line, or they are facing the wrong direction.
Exactly.
Etc. Or some of them are
Growing.
not able to erupt or to come out into the mouth.
And they grow
fully.
up normally.
So, especially the one you're talking about is the wisdom tooth, which is the last molar.
Yes.
And especially the lower one. It has a tendency of growing facing the other last standing tooth. And that happens basically because there's not enough space in the jaw to be able to come up. So in that case, the tooth stays buried. Unfortunately, sometimes they peep just a little bit above the gum, and then it creates a space, a V-shaped space between that tooth which is buried and the last standing tooth. And then obviously food starts to pack there. Bacteria can comfortably grow there, and you are not able to disrupt them. Why? Because to begin with, it is very far, so even your brush reaching there is a problem, and it's behind and down deep inside a bit. So what tends to happen at long last, by the time you're 20-something, 30s, you find that that tooth which is buried and the last standing tooth develop cavities. And the cavities are in such awkward places, like very close to the root on the standing tooth, that even to do a filling or to save that tooth becomes a big problem. So you may end up losing two teeth, that standing tooth and the one which is buried. So if people were to be going to their dentist more often, one, the dentist will be able to monitor what is happening every time you visit. And if there's need to remove that buried tooth, then it would be recommended for removal. Yeah, at the appropriate time.
Lest you lose your wisdom and support. Lest you lose your wisdom and your support.
That's right.
It gets a bit tricky to convince someone to lose that tooth because Ayumi, it's not shaking. It's very much intact.
Yeah.
Someone may wonder, kama ile inauma, ama ile inatingika kidogo inauma, na hii haitingiki, daktari.
Yes.
How painful can that get?
The thing is in a dental visit, you do x-rays and things like that, and you're able to show the patient clearly what is happening underneath there. You can show when the bone is being destroyed, you can show the orientation of that tooth, which way it is tilting, and then you're able to discuss the risks, like I've just said, of ending up losing two teeth instead of one, which is not even helping you to eat because it's buried. It's not helping you at all. So you'd rather lose that one which is buried and save the last standing tooth.
So just like a minor surgery?
It's very minor, really.
It's very minor.
We do it right in the clinic, so we don't have to take you to theater.
There's no theater involved, guys.
No,
it's
no,
right
no,
there.
no.
Just someone anesthesia and
That's
you're
it.
good to go.
That's it.
And then I leave it to you. You do your thing and we're good.
Yeah, well, you just have to open the mouth for almost 40 minutes, though.
Ooh.
Yeah, but that's almost the average amount of time people open their mouths anyway in the clinic.
On a lighter note, there are people who talk longer than that. There are those that talk longer than that.
That's
so
right.
other than the issues and the problems that we've discussed that affect dental care, what other problems are usually common in Kenya, and what should we do to take care or to be proactive about it?
Well, one of the things I've seen commonly recently is sensitivity of teeth, you know. And this is common nowadays with these women in their late 20s, 30s, 40s, professional women, very educated, and they are health conscious. And what they are doing is they are taking lemon juice, you know, like they pack it in a bottle and walk around with it, and they keep sipping. And what they are forgetting is lemonade is basically citric acid, and they are wearing off their tooth surface, and that is causing sensitivity. So I would recommend for those ladies, please, or anybody else, please just sit down, take your lemon, and move on. You know, rinse your mouth. That would be very useful after taking the citric acid or whatever, the lemonade or lemon juice or something like that. I think it will be very useful to rinse the mouth to reduce the amount of acid, but take it in one sitting. Don't keep sipping, because the more frequent there is acid in the mouth, the more erosion we get in the mouth onto the tooth surface.
Right.
The other thing is we are having quite a number of other oral conditions which are not necessarily dental per se, like cancers in the mouth. You know, that is happening quite a lot, and you find this little swelling in the mouth that is not disappearing, or ulcers and things like that, only to realize it's actually a cancer. So I would say anytime anyone sees anything unusual in the mouth, just get a dental appointment. Do not go anywhere else. First visit the dentist. The dentist is not all about teeth.
Yes.
It's all about a mouth doctor. I think we should change our name.
Mouth doc.
Mouth doc. That's right.
Yeah, visit to the mouth doc.
Yes.
Actually sounds a bit swaggerific, kind of, you know. In the course of preparing for this interview, I came across some very interesting information, and it touches on Talan. Talan is an enzyme in saliva, and it's usually responsible for the breakdown of starch, carbs, which begins right from the mouth. However, a study seems to suggest that too much Talan in your saliva can affect your dental health. Is it true, sir?
I think this is not some information that is in the mainstream kind of things that we are concerned about.
Yes.
Because it would be very unusual to have too much Talan in the mouth. I haven't read the paper, for instance.
Okay.
But there are all sorts of claims. I mean, like yesterday, somebody sent a video, and a medical doctor, I mean, I think they claim to be, they are saying doing root canals can cause heart, you know, the main cause of heart diseases.
Yeah.
I mean, like something just from the blues, and without any hardcore kind of research
and
done.
medical backing.
Yes.
Yeah.
So I wouldn't say Talan would be a big deal, to be honest. But you know, in science, if you do research, you'll always find some associations here and there.
Yep.
But it doesn't mean that it is reproducible everywhere. And it is usually very difficult to pin down one single identity like that now to dental disease or oral health problem. I wouldn't say it is.
So then the best conclusion would be, if it is a specific study, we wait for its conclusion. But
Absolutely.
It shouldn't be interpreted as a blanket observation,
and especially
across board.
Absolutely, and especially if the researcher or whoever is claiming this, as soon as they found something indicating some positivity to something, they straight away go to the media. I think you have to watch out, because it could be somebody who is trying to generate an anti-Talan product, and they want to sell it. So you have to watch out all these commercial interests. But I think it's a challenge I would want to go, and actually now you stimulated my interest in that. I'll go and read it maybe and see.
Yes.
But otherwise it is not in the mainstream. That is why probably it hasn't crossed my mind that anybody would be questioning it that much. Yeah.
We're literally headed to the top of the hour, but not before we are sensitive to our viewers in Naivasha, because we've got quite a viewership in Naivasha, and you know, courtesy of the water they consume, their teeth just end up, it's called dental fluorosis?
Fluorosis.
Fluorosis, I beg your pardon, and gets brown over time.
That's right.
That condition, Is it treatable or is it manageable? And if so, what are the do's, what are the don'ts?
Well, there are many ways of tackling dental fluorosis. And the best way is always to avoid taking water that has a lot of fluoride. Now, that said, how do you do it? I mean, the source of water is almost predetermined, but there are ways now that people can have for fluoride filtration, and that can be removed.
Yep.
There are small gadgets people can buy, like a little bucket that you can filter through. Those who can afford, they can buy water from the shops for drinking and cooking. So any water that goes into the body, you must make sure it has very little fluoride. There is the recommended levels. So people can use that. But if you get to use water that is from a borehole or whatever, if it has been gotten from the underground or rivers that are flowing within the Rift Valley, the chances are that it will have a very high fluoride content. Now, it's a paradox because at one point when we started this program, we said use a toothpaste with
fluoride
to protect your tooth.
And here we are.
And here now we are saying fluoride in Naivasha, Nakuru,
Ni mingi sana.
Kajiado, Athi River and all that is too much, and it's destroying your teeth. Yes, it is true. And the point is, during the formation of the tooth structure, if we have a lot of fluoride in the circulation, then the crystals that form are not the natural calcium-based crystals, which are very good for making the white tooth.
Okay.
So now the calcium is the phosphates and all that, they are replaced by the fluoride, and then the structure now becomes a bit brittle. Once it's brittle and porous, then it picks up all these stains. So the issue is how much fluoride. So when it passes beyond that 1 part per million, then it is dangerous.
Okay.
When it is less than that, it is protective.
Right. And you know what? We've had our mouth talk right here, and we've touched on quite a few issues, but we cannot exhaust all today.
That's right.
We
yes.
definitely cannot exhaust all today. So come another Tuesday, Health Tuesday to be precise, we shall dedicate another program to look into issues affecting your dental health. However, we are not too insensitive to what you're going through, and some of you will win a dental checkup.
That's right.
Right. Some of you, and I think 6 of you, right? 6 of you will win a dental checkup, courtesy of Good Morning Kenya and Dr. Muli here, his center at Hurlingham, right?
Yes.
And all you need to do is to check out my social media platform, our social media platform, and we shall be giving you details as to how exactly you can win your dental checkup. Easter does indeed come early for all of you lovers of Good Morning Kenya, and we love you too. So this is our Easter gift to you. Our bunny eggs are quite literally ready for you. And all you need to do is to check out our social media platforms, and we'll be telling you exactly how you can win a free dental checkup this Easter, courtesy of Good Morning Kenya and Dr. Tony Muli right here. Thank you for coming to the show.
Thank you very much.
It's always a pleasure to host you. I've hosted you once, though. But, but I'm operating on a wavelength of faith. I'll host you again and again and again. And thank you for watching Health Tuesday. My name is Samuel Njoroge. Enjoy what is left of this day. God bless you all abundantly, and we shall see you tomorrow bright and early for yet another edition of Good Morning Kenya. Keep safe.